Hi, I'm Jennifer, and this is our Introduction to Radiation Oncology. Today we're going to talk a little bit about the science behind radiation therapy, the history of radiation therapy, and the services that we offer here at Inova Schar Cancer Institute. So what is radiation? We are able to kill cancer cells and limit the exposure to healthy tissue with radiation therapy treatments. Now, if you've had an X-ray, you've had a CAT scan, you've been exposed to the same type of radiation that we use here to kill cancer cells. The difference is the energy behind it. Now, if you think back to the last time that you had an X-ray at the dentist, they cover you up with this heavy lead apron. Well, the reason they cover you up with a heavy lead apron is because they're using a very weak energy X-ray, and they are aiming it at a specific part of your body, but they don't want that X-ray to go anywhere other than that, where they need it to go. Well, here we use about 1,000 times stronger X-ray. So we are able to tell it where it needs to go. We are able to focus that beam of radiation. So we will not be covering you up with a lead apron. All of that protection is done inside the machine. Now, I think of this high energy X-ray almost like a fire hose. Now, if you were having a party in your backyard and you had a bonfire and the bonfire starts to get out of control, you wouldn't grab the garden hose and the sprinkler and try to put the fire out. You'll call 911 and the fire department will use the fire hose to put the bonfire out and make sure it doesn't spread. The principle is the same. The water is the water. It's really just the energy behind it that's able to put out that fire. In the image, you'll see if we were just treating that square of tissue, the cancerous cells are purple and the normal healthy cells are pink. Now, in order to make sure that we treat all of those purple cells, all those cancerous cells, we have to treat a border around it of normal healthy cells. But the amazing thing about the body is that each cell, each strand of DNA, has this repair mechanism. And this repair mechanism recognizes the radiation and says, hey, I need to repair myself. And it has the ability to do that. Cancerous cells don't have that ability. So as we treat day after day, the cancerous cells are going to die off and be replaced with normal, healthy tissue. If you're watching this video, you most likely have already met with one of our radiation oncologists, and they may have said that radiation therapy is appropriate for you. Now, if they have, then you may have already had your planning session, or you may be waiting to have that appointment. The planning session, for me, I think is the most important appointment that you have with us. It's really how we design that treatment plan for you. Once that plan is done, now we're in this window, right? I've had my planning session, but I haven't started my treatments. What the heck are we doing? There's sometimes a 10-day window between those two appointments, and we're doing a lot of behind-the-scenes work to design a treatment plan that's specific to you. I could have 10 patients come in for planning sessions in one day, all being treated to the same part of the body, but nobody's treatment plan is going to be the same. Nobody's body is the same, and nobody's cancer is the same. So we are working to create something that's very customized to the individual.